When writing an EBP paper, it is important to take into account the components of an effective research paper. Here's how to write each part of your EBP nursing research paper. Introduction. The introduction section of a EBP nursing research paper should 1. Define the problem. It answers the question. When identifying the problem in an EBP paper, be sure to state: patient problem. What problems does the patient group have? What needs to be solved? Intervention. What intervention is being considered or evaluated? Cite appropriate literature. Comparison. What other interventions are possible? Cite appropriate literature. Outcome. What is the intended outcome of the research question? 2. Introduces the key concept, thus providing a transition to the next section, which reveals that the target population. 3. Clearly states the purpose of the report. 4. Identifies the target population. 5. State the significance of the problem. 6. You should include a clear statement of the research problem at either the beginning or the ending of the introduction. Part 2. EBP Literature Review. The literature review provides a detailed overview of the studies that have been conducted on the topic you are discussing. You should also include any relevant quotes from these studies. When writing an effective EBP literature review, it is important to keep in mind the following tips. 1. Take the time to read all of the articles you're citing in your review. 1. This will help you to understand the literature better and place it into context. 2. Be sure to cite your sources correctly. 2. If you are using a journal article, for example, be sure to include the author's last name and publication year in your citations. 3. Be concise in your writing. 3. A literature review should not exceed 10 pages in length. 3. Try to focus on key points and highlight why they are important. 4. Use analytical techniques to help you evaluate the literature. 4. For example, consider using qualitative or quantitative methods to analyze data. 5. Make sure that your writing is accessible to a wide audience. 5. If your research is technical, be sure to provide clear explanations of how the research was conducted and what it suggests. Methodology. The methods section should describe how you researched the topic you are writing about. You should include details about the study you chose to use, as well as any statistical analysis you performed. Instead of collecting data through surveys, interviews, or clinical records, as you would in a quantitative or qualitative study, the data you collect is the literature produced on your topic. Evaluate your sources by considering: how trustworthy is the source? How accurate is it? And does the source have a bias? The credibility of a study material. The validity of the study. Does the study measure what it says it measures? What demographic sample did the study use? If a study does not produce an accurate margin of error, then it may be invalid or inaccurate. Getting a true sense of reliability, the same test needs to be done and yield the same results. The test needs to end when results have been favorable. The results of the study are valid. The report suggests high levels of consistency and validity. Findings. The results and discussion section should provide a detailed analysis of your findings. You should discuss the implications of your findings and how they can be used by policymakers. Your findings will be an analysis, possibly including a chart or table. You should present the studies you selected as the most appropriate sources for studying your problem and instituting your proposed change. Be sure to compare the following aspects of each study. 1. Demographics, pools, and samples. 2. Methods of discovery and analysis. 3. Results and limitations. Discussion, conclusion, and recommendations. The conclusion section should summarize everything that has been discussed in the paper. It should provide a summary of your findings and make any recommendations that you have for policymakers. Be sure to 1. Argue that the findings lead to the specific change in practice you identified in your introduction. 2. Suggest a strategy for implementation. 2. Will the change you recommend, and that these studies probably also recommend, work in your situation or not? Why? What changes might be needed? That should be all to include in your paper. If you need some evidence-based research paper topics or ideas to check out, please check the list in the description. Thank you, and please subscribe to Nursing Study HQ as we will help you learn.